Welcome to Dr. Cherie's podcast. I have a very special guest with me today, and I want to introduce you to Cherie Benarzi. She is, number one, a great human being, but number two, she's also a fabulous medical coach, and she teaches medical coaching to people worldwide on the World Wide Web. So during this time of crisis, it's one of those things that you might want to consider searching her out and using her incredible wisdom to benefit you and your community. So with no further ado, we're going to be talking today about what we're all facing as a global community. And please welcome me in joining Cherie Benarzi.
Hey.
Hi, Cherie. Hi.
It's great to be here with you.
Yeah, I'm delighted to have you. We've been talking about this for a long time.
For a long time,
this is the moment, finally, because of you. Yeah. So we want to be talking a little bit about the coronavirus or COVID-19, whatever you want to call it. It's the pandemic officially because the World Health Organization. And I wanted to interview you because, number one, you're so connected to the health and medical community. You so passionately care about people's health, and you so desperately want them to do the right thing as opposed to overreacting or doing nothing, because those two polarities are not helpful. So tell us what you would like to start with.
Well, first of all, I'd like to start with what you started with, which was the term global community. Yeah. So if there's one gift that we are receiving from this situation, and there's always good and bad, always, is that we are finally understanding that this illusion of separation, you know, different genders and religions and ages, and it's all an illusion. We are one big global community, and this is where our strength is. Yeah. And this is where we can draw the strength and the courage and the skills to get through this. And we will, because it will end at some point.
At some point. And we need to unite as opposed to separate. Now, unite doesn't mean we're going to gather together, but it means that we unite our spirits, our minds, our caring, our kindness, our generosity of spirit. We unite in that way.
Exactly.
So will you say more about the gift part of it? Because I don't think anything on CNN is focusing on the gift.
Well, I like to look for gifts everywhere. So it's kind of, it's kind of a way that I like, it's a way of living, okay? So there's a lesson and there's a gift. And sometimes the lesson is the gift. And sometimes the lesson is a little bit different, okay? But they're usually connected.
All right.
So usually the gift is what we call in medical coaching a positive learning. So what is the good thing I'm learning about myself here? Okay, because I can learn that all people, that people don't care. That's a learning too, but it's not a positive learning.
Yeah.
So, maybe I came across some people that don't care, but what is the good thing I'm learning about myself? That's the learning.
Okay.
And through that, I can find the positive things. There are these golden nuggets. So when I look at the corona situation and I say, okay, so what are we learning here? We are learning that we can still connect even though we're physically separated.
Great.
Wow, that's a big thing.
And it wouldn't have been true 20 years ago.
Exactly. Not only can we connect, we can create true intimacy like this. That's a big thing. That's a huge learning. We can connect, we learn about more aspects of empathy. So we learn, for example, we learn how to do empathy online, not just hold someone's hand physically, but how can we create a safe space where we're not physically there? Isn't that an amazing learning?
It's a changing paradigm as well.
It is.
We're changing the paradigm from having to be up close and personal to being able to be remote and up close and personal.
Yeah. So that's the first learning. The second learning has to do with a sense of community. So the concept of, a global community, a global village, it was true up until now in a business context, but now it's becoming emotional. So, I've been supporting coaches in China these days. I've been supporting coaches in Italy these days. I'm working internationally. So, as we connect, and the sense of having this global community of coaches, but it's, it's a global community, period.
Sure.
All of a sudden, it's not just professional. It's not just these webinars where, I teach stuff. No, we connect as human beings. And again, and there's an agenda. And this is what I love about the corona, okay? If we can say that, is that the connection has an agenda, and the agenda is genuinely to promote goodness.
Oh, that's nice.
So we're coming together to promote goodness. That's huge.
Well, it's massive because we've been so divided. As a matter of fact, I've been referring to the place that I was born and raised as the divided states, as opposed to the United States, because it's not true anymore. And if this could be the catalyst for us to be able to connect with our hearts, to be generous and kind, to be compassionate with other people, and to be able to connect with that goodness that you're referring to, oh my God, it would be such a huge gift to us globally.
In Israel, there's a similar thing. We went through a third election, okay? We're pretty divided. But now when I go down to the grocery store, then I knock on my neighbor's door and I say, are you okay? Do you need me to get something and leave it at the door? It doesn't matter who she voted for, okay? It just doesn't matter anymore. Because now there's something that brings us together as human beings. So in that aspect, our humanity is bringing us together. And that's huge. The only thing I'm kind of asking, but I'm going to ask that later. It's like, why did we need Corona for this? But now maybe not. It might not be the time, to dive into that right now. But we might want to remember that we have that capacity. We don't need versions of the corona to understand that we can come together through our humanity. We just don't need that. We can do that every day.
Okay, so I was thinking that also this is not only just impacting the medical health of people, but it's also impacting the supply chains, it's impacting the stock market, and maybe it's sending us another message that the system as it is broken, but we haven't acknowledged that. And maybe
it needs to change.
And maybe broken isn't enough. Maybe it needs to be dismantled. Maybe it needs to be recreated and started anew. Maybe we need to get rid of the old dysfunctional ways of interfacing with each other that are based on greed and not caring for our human brothers and sisters.
So another aspect of that is the fact that we've been consuming like crazy.
Oh, mad.
So hey, we can live and we can live well and consume less. Okay, so that's a good lesson as well. We see changes, in air pollution around China. Like that's a big thing. Okay, when we come out of this, the trade of exotic animals will stop. That's a huge gift.
I certainly hope so. I mean, I
hope so too.
Yeah.
So there's something that we need to update in the way the system works. This is not sustainable. It's not really ecological on many, many levels. And this is a good opportunity. My wish is that we really take this opportunity to learn. This situation is kind of like what is called in anthropology a liminal space. We also use it a lot in medical coaching. So a liminal space is a space that is not defined. So first of all, usually you don't choose to go into a liminal space. Life kind of throws you there, where when a very defined period has ended, okay, and another defined and clear period hasn't begun yet, and you're in between. It's neither nor. Like for example, having to be in your home, in your house, okay, separated, or like being in the hospital. Or like you can also look at engagement, like a liminal space. You're not a bachelor anymore, but you're not married. Okay, so it's in between. So a liminal space can be a very confusing period because it's neither nor. Okay, you feel like you don't have a ground underneath you. You don't have the clarity that you need. Sometimes you're physically separated from a lot of resources, from your a little bit out of your comfort zone. All of that. But there's an invitation here. There's an invitation to use this time to go deep and heal.
Yeah.
and also make the changes that you need. So when the next defined period starts, and it always does, it always will, you have some choice there. And isn't that amazing?
I love that. I've always called the liminal space a parenthesis in life. I didn't know that word liminal. Now I've got another gift, another new word to add to my vocabulary. I love it.
There you go.
So if we were to make a list, I'm not saying that we should right now, but if we were, and our viewers were to make a list of the things that we witness that we think should be addressed, altered, or possibly changed or transformed during this liminal space. You mentioned exotic animals and their treatment or mistreatment. Maybe there are other things like human slavery. Maybe there are a variety of other things like global warming, or a variety of things that we say, no more, not on my watch. That's it. We're done with that. This is a new chapter.
Mm-hmm.
Wouldn't that be interesting if we had people send to us their lists of things that they say, we need to be a global community. We need to learn the lessons from this situation. We need to look at life as a gift, and we need to face this liminal space in such a way that it brings out the very best in us as opposed to the worst.
Because a challenge or a crisis can do both. But there's a catch here. So I would like to kind of reframe this request just a little bit and say,
go for it.
Start with yourself. Okay, because it's easy to say this needs to change and that needs to change and the government and this. No, okay. What am I changing? What am I willing to release in this liminal space? And what am I willing to commit to? So am I willing to commit to practicing compassion every day? Am I willing to commit to practicing non-attachment every day? Am I willing to practice and commit to seeing people beyond their circumstances?
Oh, that's great. And not necessarily who they voted for.
Exactly. Am I willing to look for the things that are common between myself and the people that physically live around me? Am I willing to give one compliment a day? Say something nice to someone. Non-attachment. They don't have to return the favor. Genuinely, authentically say something nice.
That's lovely. Even hold the door while you're saying something nice.
Sorry?
Hold the door while you're saying something nice.
That could be nice. Yeah.
I love that. So starting with yourself, then moving to your inner circle, then from your inner circle to your outer circle, and then to those people, and then starting to look and see, the opportunity here, and bringing people into that conversation about what am I willing to change? What are you willing to change? What are we willing to change? What can we do to make our world a better place for all of us?
Exactly. That I realized this, when my child was very little. She's 17 now. I used to walk with a stroller with her, and near where we lived, there used to be this park, and all the old people were parked in the sun. Like their caregivers would just take them with the wheelchairs and park them there, and they were very lonely.
It was a vitamin D meeting.
It was a vitamin D meeting. Okay. So they would be parked in the sun, but no one would interact with them, and they wouldn't interact with each other. So there would be this row of wheelchairs and old people sitting there and soaking the sun. And we would go by with a stroller, and my little munchkin would go like, hello, hello. And it would be like, as we were passing, these people like, like flowers, they opened up. And I said, oh my God, it's as simple as that.
It came
so then we used to park them with them. We used to park there with them. And she used to chat to everyone. So, she was in her stroller on wheels, and they were in their wheelchairs on wheels.
Wheels. That's the commonality. It's the wheels.
Exactly.
They go round and round. So it's a lovely story about your daughter bringing life to the old people who are parked in the sun in their wheelchairs and acting like they were in elevators.
And it's as simple as that.
Yes, going up, going down. So I love that. Go ahead. What's the next thing?
So the next thing is looking at the here and now. Okay? Because here and now, people are confined here and now people are in survival mode. Here and now people are struggling to find balance and grounding in the not knowing. And right now people are really worried, and they're experiencing different forms and levels of anxiety.
Yeah.
So let's take those principles and bring them to the here and now, because they do apply.
I like that. Let's do that.
So first of all, let's start with, under the current circumstances, first of all, let us be able to see ourselves beyond these circumstances. Okay?
That vision.
I might have, sorry?
The vision of how I would to see myself. Yeah.
Yeah. So it's seeing myself, first of all, seeing that this will end.
Yeah. That's a good
So there's going to be a day where I'm going to come out of confinement, or there's going to be a day where I get back to work. There's going to be a day where we start rebuilding. Okay? And we're going to have to do a lot of rebuilding in terms of the economy. There's a lot of rebuilding to do. So first of all, start thinking about that day, because it opens a horizon. Okay? It's like this, it's setting this big lighthouse. It doesn't end here. This is not everything that is, there is more. It's up ahead. We're not there yet. I might not be seeing it clearly, but I need to see that it's there. That's the first thing.
Okay.
And the second thing is to be able to see myself beyond these circumstances. So even though I'm feeling stressed and I'm feeling worried and I'm very, very scared, I am not my stress, I am not my fear, and I'm not my worries.
Now that's similar to what you do in medical coaching, is that you have people see that they're not their condition, they're not their illness, and you have them separate the illness from their essential self. I think that's a very valuable and profound exercise to do. What could people do to be able to separate themselves from this condition? Because I think you're right. I think they have a mantle of worry, fear, and anxiety wrapping around them.
So first of all, it's understanding and repeating repeating this like a mantra. I am not my thoughts and I'm not my emotions. I have thoughts, I have emotions. I also have elbows. I'm not my elbows. I'm not my knees. Okay, same thing. Okay, I have them, they're important, I use them a lot, okay? But I am more than that, okay? So it's like looking at health from a different perspective. Health is no longer an opposite of illness. Health becomes a state of mind. So when I'm whole, I'm not a broken person, and I can see all the different pieces, all the different aspects that are me, okay? And I can see the things that I have and are not me, but I have them and they're a part of my life. Then there's an experience of being whole. It doesn't mean I'm happy. It might be challenging right now. But just stand in front of the mirror and say, this is who I am. I am more than my thoughts and I am more than my emotions. Don't say I am not, because when we repeat not, then our brain kind of deletes that. So,
so it's the shift from, if we will, being and am to having.
Yeah.
And so rather than I am my fear, or I am my worries, or I am my anxiety, or they have me, my fear, anxiety, and worries have a hold of me, I actually start separating into almost like a bowl, if you will. Like, I have this concern, I have this fear, I have this worry, but it's not who I am.
Exactly. That's the first step. The second step is, what is the good thing I am learning about myself, and what is the good thing I can trust about myself? And again, that's beyond circumstances. Can I trust myself to be compassionate? Can I trust myself to care for the people that I love? Can I trust myself to be sensitive? Okay. So what is the good thing I'm learning about myself, and what can I trust in myself or about myself? That's step number 2. Once I identify that, then I can look back at the circumstances and say, okay, so what is the 2% truth here? Because everything has at least 2% truth.
2% truth.
Yeah, it's a principle, the principle of 2% truth. Okay?
Okay.
So that's the little nugget of a fact. And everything starts from a little seed that's probably a fact or truth, and then it grows and grows and grows and grows and grows. And sometimes it grows like this, but sometimes it grows like, and there's a huge distance, a huge gap between the size and the original truth. So, for example, let's say that I'm really, really stressed about the financial condition, okay? So what is a true percent truth here? The true percent truth here is that there is a shift in economy. It's really not stable right now. And I need financial security. That's a 2% truth.
Yeah.
All the rest is a story.
About it, and blows it out of proportion.
Exactly. And once I have the 2% truth, then I can exercise self-compassion.
Now, it reminds me of the geocentric versus the heliocentric models, where back in the 14th, 13th, 14th, 15th centuries, everyone on planet Earth believed that the sun revolved around the Earth. And that was the geocentric model. Everybody believed that. It wasn't true, but they believed it. Now, once upon a time, somebody probably said some 2% of truth, and then they blew it out of proportion and made the Earth the center of the universe. Model. And then, down the road, we had Copernicus and Galileo who were willing to speak truth to power and willing to say, I don't think so. I think there's something different here. But it's out of that huge paradigm shift that we got to truth, and that we shifted our reality and our paradigm into something that resembled the truth, as opposed to something that was the 2% truth blown out of proportion.
So if we go back to the corona, okay, and the fear of catching it and catching corona. So what is the 2% truth here? The 2% truth here, that this is a virus, okay, that can be dangerous, okay? And we don't know, we can't control whether we catch it or not entirely. We can do a lot to reduce the risk. We can do a lot to reduce the risk. But at the end of the day, there's the 2% truth here has to do with the fact that being sick is scary. It can be dangerous. This is it. So once I identify that, okay, and I understand that corona is another virus, okay, it's not Ebola. It's not lethal to 100% of the population. Right. It is a very aggressive form of the flu. And the flu is not a joke.
No, not at all.
In general, flu viruses are not a joke. Okay, you need to take them seriously. So if that is a 2% truth, and then another aspect of that might be that these times we are going through a very, very rough and tough flu season. We've been there before. It just didn't have a name.
Yeah. So that 2% truth, I think that's interesting. So if I were to say the 2% truth about this, it would be something like, this is a wake-up call. And the wake-up call is to, number one, take really good care of ourselves. That's something that we might be able to do. Number two, along with taking really good care of ourselves, we want to take really good care of each other.
Yes.
Like you asking your neighbor if you could fetch her something at the store. I mean, that's just kind. It's just pure kindness. And
it's pure human kindness. We don't need corona for that.
Well, we obviously have been lacking in kindness. And so the universe said, you need a big dose of it, guys. So I think that, the 2% truth would be, I myself am still well, healthy, functional, and I can help others.
Exactly. And that's a big chunk of, that's even more than 2%. Okay. And once I have those nuggets, those 2% truths, then I can really start exercising self-compassion and self-care. And let me say something about self-care, okay? It's because there are a lot of articles online, self-care, go get a massage, treat yourself to mani-pedi, yada, yada, yada. No, that's not self-care. That's nice. That's a lot of fun. But self-care is actually a radical concept. where I consciously choose to make decisions to take care of myself. So self-care, first of all, is based on self-love and self-compassion. Cannot do that without those two. But self-care is also learning to set boundaries and making requests and opening your heart and willing to be unattached and willing to be vulnerable. And then, yes, sleeping and eating properly and making sure that you take full responsibility for your health and you show up. You know, if you're having a health condition or you're living with a chronic illness, then self-care also means that you show up in your doctor's office as a partner, not as someone that's bringing their body into the garage, you know, fix me, doctor. No, that's not self-care. Okay, this is a partnership.
I love
a
that.
lot of aspects to self-care.
I love that. Is there more to say about the self-care? Because I think that most people really do think it's getting my hair done, getting my mani-pedi, and getting a massage, and going out to dinner. And that's really the list of self-care, because it's all the things that I don't do for myself that somebody else could do to fix me, make me better, look better, sound better, have better nails, whatever. So what else goes into self-care?
So one of the principles of self-care is clearing toxicity. Now, toxicity can be in the environment, it can be in the food, but it can also be in relationships, and it can also be internal, like limiting beliefs, and and a toxic self-narrative, the things that I say to myself. So clearing toxicity, that's a big one.
Now there are people who say to me, but it's my mother. I can't clear toxicity because it is in my mother, and I cannot change her, and I cannot abandon her. I just have to put up with her worries, her fears, her anxieties, her toxicity that drives me mad. What do you say to them about clearing toxicity?
Well, here's the thing. It's not about changing my mom, okay, for example. It's about deactivating the activation button, because there's something about her that I don't like about me, okay? That's the activation button. There's something about how she is, who she is, that triggers me. We don't want to change her. We want to clear the trigger. And once I clear the trigger, and my mom is my mom, but it doesn't activate me or trigger me, then you know what? I can see her beyond her circumstances.
That's great.
And I can also set clear boundaries.
So you can actually see the best version of her without all the static that's in front of you that's blocking it because of the triggers that are dragging you back into that amygdala brain.
And I can also set boundaries. So maybe there's certain things that I really cannot do for her, or I need to do in a different way for her.
That's really nice. Really nice. Now, I think, if you don't mind, I would like to just say the serenity prayer, because it's something that I say every single day that gets me through the day and also elevates me out of the fear and anxiety or concerns or whatever might be going on.
So before we do that, can I just say one more thing about self-care? We said clear toxicity because that's a big principle. The second is raising the vibration, raising the energy. And that's about doing things that nourish my soul, doing things that nourish my body, doing things that open my heart, doing things that make me a part of humanity and promote goodness. And that's raising the vibration.
I love that. And we could do a whole podcast on just that. And I would look forward to doing that with you. Absolutely. So I'm going to say the serenity prayer, and then I'm going to give some hot tips, which you'll probably add to, I'm sure, because you always have every perspective to add and embellish. So the serenity prayer is whoever you pray to, whether it's God or Yahweh or Allah or Buddha, it doesn't really matter. But whoever you pray to, you insert their name in the first part. I'll just say God, generically. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. That's Reinhold Niebuhr's Serenity Prayer, which is done through 12-step programs worldwide. And for me right now, it's the wisdom to know the difference between what I can't change and I have no control over whatsoever, and I give that to God, and the things that I can change and I can find the courage to step up to those. And it's that wisdom to be able to separate those buckets and not have them overflow into each other.
That's critical, because one of the biggest stressors are things that we have no control over, and they're affecting our lives.
Yeah.
I had a session with a client the other day, and one of the metaphors that we brought into the space was standing on a little dinghy, in an ocean, where they're big waves. So big waves are really, throwing the dinghy about, and you have to find your own balance in it.
Yes. Yes.
So it was about that. So the big waves we have no control over. The only thing we have control over is the way that we choose to find our balance again and again and again. And we know that as long as we're in a dinghy in the middle of the ocean with these big waves, we're going to have to practice finding our balance again and again and again and again. And that's the way it is.
So now I'm going to throw out a hot tip, and you can throw out one also if you want. And these are just tips that might help with the serenity prayer of giving to God what God needs, and actually having the courage myself to do the things I can do. They say that the average person touches his or her face 23 times an hour. I think that's true. And I think it's true about me, but I'm just unconscious about rubbing my nose or touching my eye or scratching my head or my ear or whatever. I'm unconscious about that. So one of the things that I've taken to doing when I go out in public is wearing gloves. Now, they're pretty red gloves, and I may be creating a whole new fashion statement, I don't know, but the gloves are a reminder to me that if I'm holding onto a railing or an escalator or a door or pushing a button on an elevator, whatever surface, the gloves are a reminder for me to not touch my face. That's number one. Number two is the masks. There's a huge discussion about to wear, not to wear. Is it a good idea? Do they make any difference, etc.? Well, the mask is also, whether it's ultimately powerful to do anything or not, to me, it's a reminder. And it's a reminder for two things. Number one, I can't control other people, as you mentioned before. I can't control their sneezing or their coughing or whatever they're doing. I can't control it. So if a person next to me on the train or the subway or the airplane sneezes without having any tissue or protection, I can have a mask that can actually protect me from that. And the mask is a reminder for me to be mindful of my environment, what I'm doing, what I'm saying, and also my sneezing and coughing, so that I protect other people from me. So both the gloves and the mask for me are reminders to be mindful. Your turn.
So I love that, because it's impossible to stop touching our face. We're not conscious most of the time, okay? So that instruction doesn't make sense. But having these reminders, that's fabulous. And that works for you, and that's perfect. I want to say something about the mask. I've been living with a chronic condition for 20 years, which is a heart and lung condition. Every winter when there's a flu season, I go out with a mask. So I'm like, this is not new. This is a really rough flu season for me, okay? But I always go out with masks, because for me, getting the flu, even if it's easy, it's a big deal.
Yeah.
So let's take the whole mask thing out of the context of Corona. This is common sense right now. And you know what? If you have an impaired immune system, like a weakened immune system, if you have living with a chronic condition, you might want to consider wearing a mask every winter when there's a flu season. That's just common sense.
Well, we do that in Asia, and Asia is very mindful. Like if anybody has the slightest signs of an illness, they always wear a mask, because they don't want to be responsible for infecting other people. Whereas in Europe and in America, it's not convenient, it's not comfortable. People kind of say, well, I don't need that, and I'm robust, and I'm healthy, and I'm young, and I don't need that. I just think that we need to maybe shift our mindset to have it be something that's not just us, but more we.
Yes, that's important.
Yeah.
Another little tip has to do with routine. Keep your routine as much as possible. And if you can't keep the old routine, create a new routine. A routine creates order and structure, okay? It reduces a lot of the stressors, and it allows us to find strength. Routine is something that gives us strength. And if you have kids, okay? And I want to say a few words about kids here, okay? First of all, they need routine as well, okay? And kids need information. When kids do not have information, they make up the missing information in their mind, and they always go to the worst case scenario because they have a vivid imagination and they're kids,
So does that
okay?
mean that some grown-ups never grew up?
Yep. Okay, and some grown-ups don't grow up, but they have this childlike aspect, and some just stay childish, okay, which is another issue.
So
But with kids,
yeah, go ahead. You go ahead with kids.
you need to explain to kids what's going on. You need to explain it in a language that is age appropriate. Give the thing a name. Use the name corona, because this is what it is. Don't call it a boo-boo, and don't call it an illness, and don't call it the thing. Call it by its name so the child can differentiate between that and other things, and then it's less scary.
So smart.
And it's very important. Doesn't matter what age the child is. This is temporary. It had a beginning. We are in the middle. There is going to be an end. There's no doubt. And that's very important for children, because children need structure. Not just physical structure, but they need the mental and emotional structure as well.
And the other thing I hear from you that you're not saying, but I hear it in your voice, is that level of certainty. Because as you educate your children about, we're calling it the corona, this is what it is, this is what it does, etc., that certainty, that clarity, that groundedness that comes across is very important to allay fears and to be able to instill trust.
And I'll say one more thing. It's more than that. It's leadership. So parents, please remember your leaders. Please step up to that, own that.
Love that. I love that. Okay, so I want to say one more little tiny tip that I've picked up along the way. Apparently, if somebody who has the virus or is a carrier, it doesn't have to be that they're full-blown sick. They just could be a carrier and it's lying dormant. If they touch a hard surface, now that hard surface could be like our phones. If they touch a hard surface and the virus somehow gets onto the hard surface, or they sneeze on it, whatever, it can last alive for 9 days. So this is another due diligence thing. It's not like freaking out over the 9 days, but it's actually taking it seriously. Like maybe I could clean the surface of my phone every day. I don't have to get wigged out about it. I could just be a little more cleaning minded. So I think that really, I mean, with your wonderful perspective on lessons and gifts and shifting paradigms and partnering with the physician and the 2% truth and, you know, opening a horizon. I love these concepts. And we will do this again for sure. I think the other thing is mindfulness. Yeah. It's being way more mindful. And I could say to myself that that's one of the lessons and gifts for me, is to become more mindful of my actions, my movements, what I'm doing, how I'm doing it, and pay attention.
For me, it connects to being present in the here and now. You set an intention and you do things with your heart and with your mind. You don't just, kind of sail through it with your mind being somewhere else. And that's part of it. Be present. Be here. Think about what you're doing. It's not just for you.
Yeah.
It's again that connection to the community.
Yeah, to all of us, our global community. I want to thank you for joining me today.
It was a pleasure.
Schedule for ages, and your words of wisdom, I'm hoping will totally. Oh God, do I dare say it? Go viral.
Let's hope.
I want your words to replace Corona in the viralness of it all. But thank you so much for joining me. I really appreciate you. You are a gift to the world, and what you bring is absolutely precious and invaluable. So thank you again. And we're going to schedule another one of these.
Yes, we are.
Okay. And thank you for joining me today. Tune in again for another one of my podcasts. I'm not exactly sure at this moment when I'll be doing them, but I will be doing them. Look for the gifts. As Dr. Shiri said, look for the gifts, look for the lessons, and see what it is about you that you want to shift and change in the middle of this global community opportunity. Thanks again. Bye.